services. You know, the other factor that we've heard repeatedly from women veterans is that they feel invisible, and it's particular around health concerns not being properly recorded while they were serving in the CAF. Often these women were silenced, they were bullied to not speak up, they were ignored. We heard of women who were raped and there was no rape kit offered. And often women were just standing the line because they had fought so hard to get there that they didn't want to see their service diminished in that way. So I'm just wondering, how will the minister address this reality in terms of the work at VAC? Because women often do not have the appropriate documentation to support the significant physical, mental health needs that they have because of the lack of records from CAF. And I'm just wondering, is there any discussions happening at a ministerial level to, number one, start addressing this more, and number two, to offer an official apology to the women who serve so that that can be recognized in the public of Canada?
It's an excellent question, Ms. Blaney, through the chair. Again, I've been following the study that you've done very, very closely because it's an area that's near and dear to my heart, having been a social worker prior to entering politics. And the stories and the testimonies that I heard at this committee are heart-wrenching. You know, they were tough. They were hard to hear, but they needed to be heard, and they need to be to be heard. If we want to do better, we have to know what's going on. We have to know what's going on the ground in order to put better policies in place. Being a minister now for the past 4 months, the file when it comes to women's veterans is of great interest to me. All of the files are of great interest, but I've got a keen interest on this one. And one of the first things that I've done is to ask my staff, and this is probably not even public knowledge yet, but I am going to be putting in place a Women's Advisory Ministerial Committee to really look at women's issues. I think that we recognize that women are 51% of the population, and I think that getting their input with respect to what is needed will certainly better inform the decisions that I make as a minister. So we are in the process right now of looking at the terms of reference, the mandate of this committee, and the membership of this committee. But again, I'm looking forward in the very near future, in the new year, that is a concrete step that I'm taking, and again, wanting to hear from veterans themselves to see what is working and what is not working. The other thing as well that I really want to make sure that when female veterans or all veterans are contacting Veterans Affairs, that they're treated with empathy and professionalism as well. And again, I know that we've heard some stories here at committee that were tough to hear, and I certainly want to make sure that our veterans receive, the best care and service possible. So looking at those types of policies, what can be done to ameliorate, to help the situation, to better the situation, is an absolutely a priority of mine. And finally, the last comment that I'm going to make is with respect to GBA+. I think when we look at gender-based analysis, it's not just a word, it's not just ticking of a box. We really have to look at all of our policies that we put in place and to really do that analysis. How does this impact women? Because we all recognize that different policies can affect, men or women or different genders differently. So we have to make sure that we take the appropriate time to put that lens with respect to the policies. And that includes physical injuries as well as mental health injuries. I think we have a lot of work that needs to be done in that area, and I am committed to doing that.